Hi, I'm Dr. Suresh Ramalingam, thoracic oncologist at Emory University and the Winship Cancer Institute in Atlanta. The treatment of malignant pleural mesothelioma has been stagnant for a number of years. For patients with advanced disease, we have used systemic chemotherapy as the go-to option. The combination of cisplatin and pemetrexed was FDA approved way back in 2003. And that was based on a randomized trial that showed that the chemo doublet was superior to cisplatin alone. And this combination has remained the standard of care for a very long time. More recently, about 5 years ago, we saw that the addition of anti-angiogenic drugs in combination with chemotherapy may result in modest improvement in overall survival. Now, that approach is not FDA approved in the United States, but it's available in Europe and certain other parts of the world. More recently, there has been a lot of interest in studying immunotherapy for the treatment of patients with malignant pleural mesothelioma. And in fact, more recently, the FDA has approved the combination of ipilimumab and nivolumab for frontline therapy of mesothelioma. Now, as you're well aware of, nivolumab is a PD-1 inhibitor, and ipilimumab is a CTLA-4 inhibitor. This combination has been studied in multiple settings. It's FDA approved in multiple settings, including in the frontline therapy of non-small cell lung cancer. Recently, we learned about the results of a phase 3 trial called Checkmate 743. This trial was done in frontline therapy of mesothelioma. This was a head-to-head comparison of EP plus Nivo versus chemotherapy for patients with unresectable mesothelioma. This trial had over 600 patients, and the primary endpoint was overall survival. The combination of EP and Nivo was associated with significant improvement in overall survival with a hazard ratio of 0.74. The other important observation in this trial is, as we know, mesothelioma consists of either epithelial variety, epithelioid mesothelioma, or the sarcomatoid variety. The epithelioid variety is the more common, seen in approximately 70% of the patients. Sarcomatoid accounts for about 15% of the patients. Now, the sarcomatoid is a type of tumor that is not very chemosensitive. And when we give platinum pemetrexed, those patients do not do well. Interestingly, in the sarcomatoid histology of malignant pleural mesothelioma, EP and Nivo was associated with a substantial improvement in overall survival. The hazard ratio was very robust. That's partly because chemo did not do very well in these patients. So now the FDA has approved EP and Nivo for frontline therapy of malignant pleural mesothelioma. It can be used for both epithelial histology and sarcomatoid, and particularly in sarcomatoid because that group of patients do not respond well to chemotherapy. What about the role of biomarkers in this setting? The investigators looked at PD-L1 expression, and the numbers were not enough to say if PD-L1 expression could be used as a predictive biomarker. At this point, the approval of EP and Nivo is regardless of PD-L1 expression. So we now have two different approaches for frontline therapy of meso. One is the platinum plus pemetrexed approach. The second is the EP plus Nivo approach. I would say that specifically for sarcomatoid, EP plus Nivo approach would be, in my view, the go-to regimen. For the epithelial histology, you could go with either one of these approaches. In reality, if patients get first-line EP and Nivo and they develop progression, I'm going to use platinum pemetrexed for those patients, and vice versa. If the patients get chemo and fail, then progress, we would give them EP and Nivo. Now, more recently, we saw the results of a randomized trial where Nivo was shown to be superior to standard of care in the second-line therapy of patients with malignant pleural mesothelioma. So that's also further reinforcing the role of immunotherapy in the treatment of mesothelioma. We're now looking at studies that are combining chemo with PD-1 inhibition, and those trials are getting started. We've seen some phase 2 results that are promising. Phase 3 studies are ongoing. So overall, it's fair to say that immunotherapy has now entered the therapeutic landscape of malignant pleural mesothelioma.